Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. Nearly half of adults across the country say worry and stress related to the pandemic are hurting their mental health. All of us are affected on some level. Mental health care workers are on the front line helping people cope during this difficult time. Kath Burns is a doctorate psychologist who is a clinical consultant for the newly formed COVID Support VT. Welcome, Kath, and thank you for joining us today.
Thanks for having me.
Yeah. So can you briefly explain what COVID Support VT is?
I sure can. So COVID Support VT is a project that's designed to provide community-based education and supports to help people better manage the stress associated with the pandemic. The goal is to prevent longer-term negative mental health outcomes and negative health outcomes. So currently we're focused on providing broad community education and outreach. But in September, we are going to be adding embedded crisis counselors within Vermont 211 so that we can provide more direct, brief supports to people to help them cope. The program is funded by FEMA, administered by the Department of Mental Health and Vermont Care Partners, who has 16 agencies across the state of Vermont who are well positioned to support people in the state.
And you're the quality director for Vermont Care Partners, which have places all over Vermont with counselors. And that statewide network, they stepped up during the aftermath of Tropical Storm Irene. What did you learn about Vermont and Vermonters and needs from that disaster, and how is this time different?
Yes, so everyone will probably recall that Irene was a point-in-time event, which most disasters are. So an event occurs, a disaster occurs, and we're able to start our recovery, the lengthy process, frankly, right away. What's inherently different in this particular process is that the pandemic is ongoing, and it has an unclear end. And so we're not really clear about when we can start recovering. So, and with Irene, what we did is we sent people directly to people who were affected by the flood. And we're not able to do that now because of safety concerns. And we're just being really creative about how to support people right now through all these different educational approaches.
So as a practicing psychologist, what are you experiencing in the field with your patients?
Yep. So Fran, I have to say I'm so lucky to do the work that I do. I work with kids and families as part of the pediatric office. And I'm speaking generally about our field. We're definitely seeing an increased number of people who are struggling with anxiety and depression and isolation. And people who already live with some of these conditions are definitely experiencing more of their symptoms because of the pandemic. So practitioners generally spend a lot of time helping people to focus on the here and now as a way to reduce their immediate stress and anxiety. I often spend a lot more time supporting caregivers to help them take good care of themselves so they can model these behaviors for their charges and be more available to support them as the world fluctuates with the pandemic. And I would say in general, for kids, schedules are great. Watching your media, how much you have the media on and the news on is important. And helping kids stay connected with friends and family and people who care about them in a safe way is just critical.
Well, let's expand on that, because I think all of us are having an adjustment disorder on some level, some certainly much more than others. What can we do to keep ourselves on keel?
Mm-hmm. Yes, Fran, unfortunately, I think this is true. And for people who don't know what an adjustment disorder is, it's basically a label we use to say that you're experiencing distress related to a specific event. And as you stated at the beginning of the discussion, nearly half of us are experiencing distress around this pandemic, and why wouldn't we? And researchers in this area are really expecting this number to grow, especially amongst more at-risk populations. So the good news, frankly, is that there's things that we can do to help us feel better. It won't take care of the big issues, but the idea is that it will help you be better positioned to think more clearly about what to do about the big issues. So
let's go back to that slide and just go through some of them quickly.
Yep. So they might seem obvious, but it's often we let these go. So the first one is stop and take a break, even for 15 minutes, just to allow your mind to stop. Things will still be there when you come back around and pay attention to them. Eat well, make sure you're eating regular meals, exercise and rest. And when I say that, I don't mean go run marathons, all right? I mean, get outside, take a stroll, take a walk, move around. It makes a big difference. And resting means stay on your sleep schedules. I'm seeing a lot of kids who their sleep schedules are all over the place because they don't have one anymore. And it's important that we get regular sleep. Connecting with friends and families every day is critical. However you do that, on the phone, over social media, or over your fence, right? You want to watch your alcohol and drug consumption and be careful that you're not using that to help you feel better. And you want to follow any plans that you already have for managing any of your pre-existing health or mental health or substance use disorder conditions.
Right. Really good and important tips and just reminders for all of us.
Yeah.
And what can we watch out for in our loved ones or even colleagues that might tell us they're struggling?
Yep. Fortunately, many people are going to cope okay if they're able to use some of the strategies that we discussed. And the good news is that we can watch out for those same things in other people, and we can model things for them. But what you want to watch for is people talking about it more. They're expressing increased concern about their health and well-being. You want to watch for, if you live with someone, changes in their sleep or eating patterns. That's often a first sign. If people are having increased difficulty concentrating, if their health problems or mental health conditions or substance use disorders are worsening, you're noticing they're having increased symptoms, or if they're using substances more. Those are good clues that something might be going on.
Okay. And so when we notice some of these things, then what? What can we do?
I know, then what? This is actually really important because there's so much stigma around mental health concerns that we often don't think we should ask. And actually, we want you to do the opposite. There's a lot we can do. And the list starts with taking care of ourselves. I've said that now 4 times, I think. And modeling how to do that for others. So model and encourage self-care. Talk about what you see and ask how you can help. It's okay. It's important to say, I'm noticing that you're not sleeping. What's going on? I notice that you're talking a lot about being worried about your health. How can I be helpful to you? You can help someone call their primary care provider, or if they have a support team, a mental health provider, you can help them reach out to them again. If someone belongs to a faith-based community, you can absolutely have them reach out to that leader, or you can help them do so. Or you can help them think about who else in your community can be supportive to you, who in your family, who are friends. It's just so important just to ask. We can do a lot for each other.
And it's really important it's okay to say, I'm having a hard time, because so many of us are. This is so different. This is so new. It is so unprecedented that reaching out is okay.
Yep. And I don't know if it makes sense to put up some of the numbers that we were going to show people now, or?
Well, I think we were talking about, what are some people that you were, well, sure, let's put the other reach out. Absolutely. Okay. So here's some numbers that people can check in right now.
Yeah, so, as part of reaching out, sometimes when you're sitting with people and asking, people are hesitant to do that because they're afraid of, what if they tell me something scary? What if they tell me they really need help? Then what do I do? And, I don't want that to keep people from talking to each other. So sometimes the easiest thing to do, if someone's saying I need some help, is to start by calling Vermont 211 and saying, okay, my neighbor is asking me for services for housing, or my neighbor is asking for information about how to connect to a mental health agency in their area. Can you give me some numbers? Vermont 211 is a great resource for all the services in your community. It's very important. Vermont HelpLink, you see the number there on the line, is specific. It will give you information about services and supports for people who are experiencing substance use conditions. And then you'll also see the 24/7 National Crisis Text Line, which is a number you can use any time of day or night if someone you are with or if you are experiencing a mental health crisis, and they'll respond to you right away and help you figure out what to do next. And I should also remind everybody that we all have a Vermont Care Partners agency in our community, and many of them have 24/7 mental health crisis lines that you can call to get some support.
Terrific. And on your website, which we'll show at the end of the program, you can have connections to all of those places. So, you know, so some people you're concerned about more that are more vulnerable at this time. What do you want them to know or watch out for? So just a quick, who is the most vulnerable during this time, and what can we do for them?
Sure. So a lot of what we already talked about will be really helpful for the most vulnerable populations. And the first step for helping them is to actually reach out. So on that list of vulnerable population are our elders in our community, children, youth, and adolescents. These two groups have really been experiencing a lot of isolation. We've mentioned already people who are already in recovery from mental health conditions and substance use disorders. People with intellectual and developmental disabilities, a lot of them have not been able to access their services in the same way and are increasingly isolated. And caregivers have really been having to pick up a lot of the care of the people around them, and that's been very stressful. People with pre-existing health conditions, it's been hard for them. A lot of them are isolated more. And then finally, first responders, medical providers, anyone who's an essential worker. And we know that the pandemic is disproportionately negatively affecting people of color and people from marginalized populations. So it's important to reach out. When we reach out, frankly, that it makes us feel better. So taking the time to, even today, reaching out to someone you know and just saying, how's it going, will actually make you feel better. So that's something you can do.
Terrific. So certainly watch for those vulnerable populations, your elders, your children's parents, certainly first responders that are working so hard. So you have many more tips at a new website that you've set up, covidsupportvt.org, which is terrific. What will folks find there?
There's a lot of information there, and we try to organize it to give people general information about stress and what it looks like. There's some quizzes and interactive things you can do to learn more about your experience of your stress. There's tips and apps and resources around where you can go or what you can do to manage your stress better. There's phone numbers and connections. There's even a downloadable daily wellness plan that you can print off if you're able and fill out what your plan is daily to make sure you do that first bulleted list we talked about at the beginning of the show to help keep you on track. I actually have one on my mirror, and look around.
Fantastic. So check out covidsupportvt.org. There's also a number there. You can find that on the website. It comes up in many languages too. You can translate it to dozens of languages. It's awesome. Catherine Burns, thank you for the work you do and for helping us understand the importance of caring for our mental health and monitoring that during this difficult time. Thank you.
Thanks for having me.
And thank you for joining us across the fence. I'm Fran Stoddard. Stay well.